the Sandra R. Berman Heart Institute at University of Maryland, St. Joseph Medical Center, our goal before and after surgery is to provide patients with the information and resources needed to recover and maintain an active lifestyle. This series of videos will review instructions regarding medications, resuming activities, and showering, as well as dietary recommendations and symptoms to watch for after surgery. Please remember to make your follow-up appointments as listed on your discharge instructions. Also, please call our office with any questions you have along the way. We want to hear from you during your journey. We believe that you actively participating in your care leads to a quicker and more optimal recovery. The entire heart team at University of Maryland, St. Joseph is here to help you get back to your full life.
Welcome home. We hope your surgery and experience at University of Maryland St. Joseph Medical Center exceeded your expectations. We thank you for trusting us with your care. We also hope that the discharge process was a smooth one for you and your family, and that you are now at home resting comfortably. Your nurse and other members of the cardiac surgery team shared many things that are important to your recovery before you left the hospital. You should have received a binder that contains important information about your recovery at home, as well as specific discharge instructions. Please refer to the binder frequently as it contains valuable information. Because we understand that the discharge process can sometimes be a bit overwhelming, we also created these short videos to help remind you of key items. Medications. You received a list of new medications to begin after your discharge to home. The medication list is in your discharge paperwork. You may have also been told to continue some of your medications while discontinuing others. It's important that you follow these instructions carefully. You should only be taking the medications on the list in your discharge paperwork unless the cardiac surgery team tells you otherwise. Please remember, you don't need to throw away those medications that were discontinued. It's possible that you may need them in the future. Make sure you share your medication list with your primary care doctor and keep the list updated for reference during emergency situations. If you're unsure of your medications, please call the cardiac surgery office. If you were discharged with a medication called Coumadin, also known as warfarin, you will be referred to an anticoagulation clinic for monitoring. When you receive a call from the clinic, please accept the soonest appointment they have. It's very important that you are monitored closely while on this medication. You should be seen at the anticoagulation clinic or Coumadin clinic within a week of being home from the hospital. Daily activity. The next item we want to cover is your daily activity. You should walk as tolerated. A gradual increase in activity will help your heart grow stronger and will help with the recovery process. You may climb stairs, but please do so carefully. Be kind to yourself and try not to get frustrated during this healing process. Bit by bit, increase how much you are doing each day. It's perfectly fine, and we encourage you to get outside and take walks, incrementally increasing how far you go. As with other activities, you can resume sexual relations when you are ready, but it's best to avoid sexual intercourse for several weeks. Be patient with yourself. It's perfectly normal to be apprehensive. You can drive a car 4 weeks after surgery, as long as you are no longer taking opioid pain medications. Before then, you should ride in the front seat of the car and do not place the heart pillow between you and the seatbelt. Showering. Nothing feels better than a nice shower when you get home from the hospital. You may face the shower, but be sure you don't rub or scrub your incision. Let the water run over it. Remember, you can reach your hands and arms above your head to wash your hair so long as it doesn't hurt. After showering, and on days you don't take a shower, be sure to use the wound cleanser that you brought home from the hospital. Simply spray your incision once a day and pat it dry with a clean washcloth. Take care not to rub, just lightly pat. You may see some redness along your incision line, and that's completely normal. Your incision can also become bruised, itchy, numb, or sore. Don't apply anything else to your incision unless instructed by your doctor. You should not take a tub bath or get in a pool for 2 weeks after your surgery. Monitoring your weight and temperature. Please weigh yourself once a day until your follow-up visit. If you have a blood pressure cuff at home, we encourage you to take your blood pressure in the morning when you wake up. If you feel like you have a fever, please take your temperature. Your binder has a page where you can log this information. Diet after open heart surgery. When it comes to your diet, it's best to cut back on salt and fat. Limit canned, dried, packaged, and fast foods, and instead look for fruits, vegetables, low-fat dairy items like skim milk, whole grains, and lean sources of protein like baked chicken and fish. Remember, your binder has an entire section about nutrition. It's the last tab of your binder. When to call our office. Many patients ask when you should call the cardiac surgery office. Please call us if you have any of the following symptoms: fever above 100.5 Fahrenheit, sudden weight gain greater than 5 pounds in a day, swelling in your legs, palpitations or your heart feels like it's beating fast or irregularly, increased discomfort in your chest, increased shortness of breath, any abnormal bleeding, especially if you're taking Coumadin, increased redness, tenderness, swelling, or drainage in your chest incision, or clicking in your chest, or any new rashes anywhere on your body. When you should seek emergency care. Any of the following symptoms can indicate a medical emergency. Do not wait to see if these symptoms go away, and do not drive yourself to the hospital. Please call 911. If you have difficulty breathing or increased shortness of breath, moderate to severe chest or upper abdominal pain or pressure, fainting, sudden dizziness or weakness, any changes in your vision, confusion or changes in mental status, any sudden or severe pain, including abdominal pain, uncontrolled bleeding, severe or persistent vomiting or diarrhea, coughing up or vomiting up blood, suicidal feelings, or difficulty speaking or finding words. If you are receiving home care with a visiting nurse, he or she will also closely monitor you for any of these symptoms. Please be sure to tell them if you are experiencing any issues. They will regularly check your blood pressure and temperature, listen to your lungs, and monitor your incisions. This is the perfect time to ask any medication questions. Typically, the visiting nurse will come to your home about 48 hours after discharge. Please also remember to make your follow-up appointments with your primary care doctor, your cardiologist, and our cardiac surgery office. Please refer to your discharge paperwork for a list of who you need to call for appointments. Again, if you have any questions about your recovery, do not hesitate to call the cardiac surgery office at 410-337-1783. Welcome home.